Hello, Heidi. Andrew here. Basically, I just wanted to do a quick head-to-toe assessment and send this over to you because this is something that I learned and I got a lot of people's input and it's helped a lot. So I'm just going to go ahead and go through it verbally if that's okay. So first of all, you're going to want to start with the head, of course. We're going to be searching for any deformities, contusions, lacerations, tenderness, bruising, any penetrating injuries, I believe I already said that, and any swelling. So you're looking for decap BTLS. If I go back and review that, I hope I said all of those. As we move down, we're going to be analyzing the integumentary system of the scalp. We want to make sure there aren't anything going on. We're going to also look at the eyes. We want to see if their pupils are equal, round, and reactive to light. PERLA is what the acronym is. Also, when you're in the face, you want to, there's a variety of tests you can look up to check for the 12 cranial nerves, and you're going to want to go through those. It's a more thorough assessment if it's a neurological assessment, of course. I finished up with the eyes, I hope. And please add, if I miss anything, please fill me in. I would love to hear your input. You're going to go to the nose. We're going to look to see if there's any deviated septum, simply looking up, and if you're seeing any sway. Okay, if there's any congestion or anything, you want to ask those types of questions if that is what's going on. You don't need to ask them if there's nothing going on, obviously. You're going to move down. You can go ears, you can go neck. I like to go ears. I like to do what's called the whisper test, which is you whisper ABC, 1, 2, 3. In each ear, you kind of change it up and see if they could hear the whisper. You ask them to say it out loud. Also, you go to your mouth, obviously, stick the tongue out. They want to make sure it's straight. We don't want to see any drift if there was one. You're looking in the mouth for anything abnormal. Hopefully you have a lot of normal patients in your career so you can see what normal looks like and then what pathology looks like. Moving forward, I want to speed this up a bit for you because sometimes you're going to have to do rapid 5-minute assessments. So we're going to go to the carotid arteries, we're going to palpate them, make sure they're patent and +2 in bounding. Not 2 bounding, but usually I'm +2 in bounding right now, as you can tell. We're also going to look at the trachea, make sure it's midline, and if there's any jugular vein distension, the best way to do that is recline the patient at a 45-degree angle and see if they're struggling to breathe. Usually see a distension. You're also looking, as you continue down, when you're looking, you're going to take broncho-vestibular lung sounds. Boom, 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 which are just these guys along the lines of the front and the back. There's certain graphs you can look. So you want to go boom, 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 boom. You can either do cardiac or lung signs. I usually check cardiac first because it's more important in my head, but because I can see them breathing since the moment I walk through the door. Or if they're not, it depends on the situation or the severity. So you want to look for rate, rhythm, and quality. Rate, how fast, 60 to 90. Rhythm, are we normal? Is there a flail chest? Is there abnormal respirations, which there's a list that you know about. What else can I say? Take a deep breath. Going a little quick here. But basically, you want to also take, like I said, you could also do what's called checking for phrematus, which is a plus when you have consolidation in the lungs, or any atelectasis, or any, what's the word, when it's the hardening of fibrosis of the lungs. Any fibrotic tissue, you could kind of do a test by taking a deep breath, and if you feel a high level of resonance in the area, you have a better idea of if there is a consolidation or some sort of congestion in the area. Side note. Let's go back to the assessment. For heart, you want to check, I believe it's called pulmonary aortic mitral herbs tricuspid. I forget the order, but boom, boom, 1, 2, 3, 4, 5. To your heart and all the different valves. You want to make sure that there's a normal S1 and S2. If there is pathology, you will hear S3 and S4 sounds. I have researched that. If you don't know what those are, I'm sure you do. Moving forward, also addressing skin throughout, making sure that's just a big one. Skin, you should just throw it off in the back of your head and go, I'm looking at skin the whole time. I know it's in good shape. You see something different, document, 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 document. Okay, we've already did our chest. We move to the abdomen. What you're going to want to do in the abdomen, palpate. If there's let's say I'm hurting in the right lower quadrant, you palpate that quadrant last. You'd go up here, up here, up here, and then over here. You'll palpate, auscultate with your stethoscope, and you'll percuss. There's a couple rhythms of percussion to hear. If you hear dull or any, you're looking for dull sounds usually when you do a percussion of the liver. It's a nice dull sound. Or sometimes you do something and it's a hollow noise. You'll hear the difference. You're looking for normal active, hypoactive, or hyperactive vital sounds in all 4 of those quadrants. You want to make sure peristalsis is moving in the right direction. So we did our abdomen. Now let's move on to, you could look at GIGU, and if there's anything, it's usually not a big part of my assessment unless it's something to deal with that area. So there are specialized assessments you can do with a physician and alone when you're handling any vaginas or any penises or any assholes. Dun dun. But sorry, I need to take a deep breath. Where was I? Neurologically, you're kind of already assuming if you see range of motion throughout motion with a normal person, you're going to see normal active range of motion. So those are things that you don't really need to assess, but you just visualize. You could literally extend your hand out to them, and if they are able to move to that extension, that's an active range of motion. You can also get into the names like circumduction and all these abduction and all those different names, but I just say fuck that. But you could. I want to go back to the hands. At this point, I missed something. I would have done it earlier because I'm not quite moving down. Kind of scattering my assessment today, but squeeze both hands neurologically at the same time. Push, pull, feet. You know that. What else can I say? Tenting for dehydration. If you lift up like this and it doesn't go back, you know how old people sometimes it's like it's loose skin, but it's also a lot of times it's dehydration. Also, you can do a cap refill. You want it to be less than 3 seconds. Push that down. See if the blood comes back in less than 3 seconds. Good way of calculating circulation. I like to say a positive SpO2. So if I see a fast, good capillary refill, I'm not too worried about an SpO2, but if you can't, don't do that. That's just me. Always put that SpO2 when you're taking vitals. And that's hopefully something you would have already been established or maybe had a CNA do for you while you were doing your assessment, or you know what I'm saying? It's just something you kind of flow with vitals. There comes a point where you're like, okay, I need it. Anything else that I could think of? You look at the legs. Again, there's not much left at that point. We look at front and anterior and posterior aspects of the body throughout the entire assessment. Usually your most important part is your trunk. That's what I've covered. You could look at the spine and see if there's any, scoliosis, lordosis, I believe, or kyphosis, any type of spondylosis. But basically, that's another assessment, just kind of have them look down. We all did that in middle school. But I hope this can conclude my assessment. Please let me know how I did. I kind of was just rough drafted and just shot it out you. I mean, I could really do it way more professionally with an actual person, but who needs that, Anyways, I hope you have a good night and take care. Great to see you, Heidi.